Good afternoon, everyone, and I just want to thank everyone for joining us on our Zoom meeting about PCORI funding opportunities. Before I introduce our esteemed speaker, I also want to thank Dr. Jill Cezak in her role as Associate Vice President for Research here in the VPHS world in the Jacobs Schools. She's done an amazing job at bringing in individuals who are going to tell us more about opportunities for funding. And today we are honored to have with us Dr. Alyssa Krumlauf. She's the Associate Director of Clinical Effectiveness and Decision Science Unit at PCORI. Dr. Krumlauf has a doctorate in Behavioral and Community Health from the University of Maryland School of Public Health. Before joining PCORI, she worked as an investigator at the NIH Center, the NIH Clinical Center and the NIH Institute on Alcohol Abuse and Alcoholism, studying sleep and other health behaviors in diverse and vulnerable populations. She's also served as an adjunct professor at the University of Maryland and George Washington University, and as a scientific review officer at the NIH Center for Scientific Review. We're excited today to have Dr. Krumlauf join us to discuss various PCORI funding opportunities available, as well as ways that we can engage with PCORI on the clinical level. She's going to specifically talk about what PCORI looks like for health equity proposals, as well as how we can access PCORI data to advance research and health outcomes. Dr. Krumlauf, thank you so much for joining us today, and we're looking forward to your presentation.
Thank you so much for having me. Let me try to share. Can someone confirm that you can see my slide?
Looks great.
Yeah, looks good.
Excellent. Great. Thank you. And thank you for the introduction. I forgot that I sent a bio, so I guess I can skip and jump right into the content here. I'm very thrilled to be here. And again, yes, huge thank you to Jill for helping me understand a little bit about you all as an organization and an institution, and how I might best tailor this content to hopefully be useful and directly relevant and applicable to your interests and your research or future research. Like was just shared, I'm one of the associate directors in clinical effectiveness and decision science. Part of my role is to serve as a program officer, but that's a very small part of my role. I have my portfolio is quite small. Most of my job is managing a team of program officers and program associates. And I also serve as the sleep topic theme development lead. And I understand that some of you might have some interest in sleep. So I will get into that later about what opportunities might be exciting to you all. Okay, so I'm going to jump right in. I think the plan is to hold questions to the end. I am very bad at reading chat and presenting at the same time, so I will do my best to leave adequate time if that works. If there's anything urgent, Jill, please interrupt me.
Sounds good, but I'll field questions for you at the end to make it easier.
Okay. Great. So I think that some of you might be new to PCORI, and I'm not going to spend a ton of time doing our overview because you can find it all, you can Google it all. But I did want to start with just a high-level overview of our mission and vision and priorities. And I'll try to focus in on what makes us different from under other funders and the processes of other funders. What is PCORI? What do we do? We are an independent nonprofit organization authorized by Congress in 2010 as part of the Affordable Care Act, and we were very thrilled to be reauthorized in 2019. We seek to empower patients with actionable information about their healthcare decision-making. We are governed by a 23-member board of governors that represents the entire healthcare community. And we fund comparative clinical effectiveness research, herein referred to as CER, which is designed to compare two medical treatment services or health practices. And then the findings from the studies that we fund are designed to, like I said, help patients and other stakeholders make informed decisions about their care. Most of what we fund is the comparative clinical effectiveness research, CER, but we also fund awards to promote engagement in research, dissemination, and implementation of projects. methodology, and then also the development and use of research infrastructure, which I know, including PCORI, which I will talk about later. And we, like other funders, we issue funding announcements several times each year. By the end of this presentation, my goal is that you could all take my job. You'll have such an in-depth knowledge of PCORI. Our mission is to ensure that people and the public have the information they need to make informed decisions about that reflect their desired health outcomes. We want to produce high integrity, evidence-based information rapidly that comes from research that's really guided and influenced by patients and other stakeholders. So what makes us different or unique? Traditional healthcare research doesn't always answer patients' burning questions that they're faced with. And too often they lack the information that they need to make informed healthcare decisions. We focus on research that patients and their families face every day, the issues that they face, including cancer, diabetes, maternal mortality, opioids, mental health, equitable access to care, which I know is of particular interest to many on this call, among many other priority areas. We feel strongly that patients deserve to know what approaches work best for whom, under what circumstances, so that they're informed, healthcare consumers. Our strategic plan, most recent strategic plan, was approved by our Board of Governors last summer. This sets a quite bold and aspirational vision for our work, and as well as a roadmap for how we will achieve that vision. This was developed with quite a bit of stakeholder input, and it also really underscores our commitment to accelerating diversity, equity, and inclusion in all aspects of our research and other activities. Our national priorities are health, are the core of our strategic plan that I just referenced. These are long-term goals that will guide our funding of patient-centered CER and other initiatives. Briefly, our 5 national priorities are to increase evidence for existing interventions and emerging innovations in health, to enhance infrastructure, to accelerate patient-centered outcomes work, to advance the science of dissemination, implementation, and health communication, to achieve health equity. Like I said, these were bold, aspirational goals. And then finally, to accelerate progress toward a learning health system. We want these 5 priorities to work together in an integrated and synergistic way, revolving around the core goal in the center, which is really patient-centered health. And then also kind of influenced and reinforced by the 2 cross-cutting themes of health equity and stakeholder engagement, which you will hear quite a bit about today. You'll also notice that these priorities are very intentionally focused on outcomes. So we use action verbs like advance and achieve, which really reflects the influence that PCORI wants to have on health, which is beyond kind of the purely clinical space. Since we have been authorized by Congress in 2010, we've awarded over $4 billion to fund more than 2,400, well, I guess my slide is outdated already. So more than 2,500 research and research-related projects. So this is kind of just a snapshot of what we've done thus far. I wanted to delve into the specific features of our research awards, including our requirements and how they might differ from other funders, the life cycle of our funding opportunities and what to expect if you're interested in applying for PCORI funding, and as well as how we manage our awards once they're awarded. So we engage patients and stakeholders throughout the research process. We're committed to ensuring that they have a seat at every table. They prioritize our research topics. They help you design and conduct studies, and they also help us share results in a meaningful way. When I started working at PCORI, one of the most striking observations I made was that PCORI takes this very seriously. And we really do walk the talk in terms of including patients and stakeholders in a meaningful way. Again, comparative clinical effectiveness research compares two or more treatment services or health practices to help people make better informed decisions. And we want our funded work to have an impact in real world practice settings. All of our applications, in order to be considered responsive, need to include a thorough description of what comparators are being proposed. So again, two or more approaches. If you're proposing to also include usual care as one of those comparators, we just ask that you kind of describe it in detail and also justify it as a legitimate comparator. So for instance, kind of speaking to the fact that it's guidelines based. Also, we want the proposed outcomes to be endorsed by patients and obviously health related. Next, we want applicants to describe work that compares two or more alternatives, each of which either has established efficacy or is in widespread use. So again, we expect that the efficacy is known and established, but if the evidence base is insufficient, then you need to make the case for the fact that something is in widespread use. If you are trying to develop a new intervention that doesn't already have any established efficacy or widespread use, PCORI is not the place that you would apply for that specific project. We are interested in work that proposes to study benefits and harms of strategies delivered in real world settings. And lastly, like I said, and we'll get into this, we expect that patients and other stakeholders have weighed in about kind of how the study is answering a critical question and why the project or the research question, why and how it represents a decisional dilemma that patients or clinicians are facing. Engagement is one of our key pillars on which we operate. It's really integral in our work. We believe that patients and other stakeholders from across and up and down and across the healthcare system should be actively and meaningfully involved. Again, from the development of what our research priorities will be and how we spend our money, but also to the dissemination of individual project findings. Engagement benefits everyone who is involved. So patients and stakeholders, communities, and since you all, based on my understanding, are researchers, I wanted to really highlight, the fact that patient and stakeholder engagement truly does benefit researchers. I'm a program officer on a study that is focused on hearing loss. And every time the PI kind of starts talking about how this PCORI award and how our expectation of patient and stakeholder involvement has impacted the rest of her work portfolio, I'm just reminded of the importance of kind of their inclusion, meaningful inclusion from conceptualization through dissemination. There's various levels of engagement. Sometimes we see stakeholders serving on ad hoc working groups, helping to prioritize research questions or help us think about dissemination strategies for projects. They can also have more sustained involvement in a study. And, we love to see shared leadership and collaboration kind of towards the rightmost area of that spectrum. There's also variability with respect to the level or intensity of partner and patient stakeholder engagement. So you can kind of see, from input to consultation, all the way through collaboration and shared leadership. I've kind of observed all of these models in action, and it really kind of depends on the project. I also wanted to highlight, or I guess I was asked to highlight, the notion that based on your research question, sometimes there are unique circumstances for engagement. So while we always want patient input, I recently had a project come through that was focused on essentially helping clinicians make decisions in the ICU. And so, for instance, oftentimes, patients don't have the capacity to make decisions in that setting. And so the project team was very thorough about thinking through clinician engagement and how and when it might make sense to involve patients. So, for instance, people who had gone through an experience in the ICU were discharged, what outcomes were important to them after the fact. So I highlight this example just to kind of say that we recognize that, oftentimes clinicians are making decisions, and we value a breadth of stakeholder input in every sense. We also have our methodology standards. These are our kind of baseline minimal requirements for how the conduct of our work, our funded work, happens. This typically becomes very important to people when they're getting ready to submit an application. But again, even if you're thinking about developing a letter of intent or meeting with a program officer to discuss an idea, it's always a good idea to kind of just take a look at these. I will say this probably 15 more times, but more information about these standards is on our website. We have a very robust suite of resources on our website that I think you'll find very helpful. And I will share these slides at some point, somehow. We are interested in funding applications with rigorous designs, such as randomized controlled trials or well-designed observational studies, if well justified. We also are interested in hybrid designs. So really, for questions that are focused on the translation of research findings into routine clinical practice, if hybrid designs are used, one of the primary aims has to be a comparative clinical effectiveness question. And the last thing I wanted to mention here is that, in terms of natural experiments, we're interested if they're rigorously designed, and they're designed, if you're comparing policies or systems level or strategies or community partners, sometimes we do see strong applications with natural experiments. Will not read through these, but this is what we don't fund. I'll highlight a few things here. Study of natural history of disease, the last two really. So natural history of disease or basic science or work that is really focused on mechanism is not, does not fall within CER. So I love this slide. I'll stay on it for probably the longest because this is kind of a walkthrough. It reminds me of a board game, but kind of what happens, like what does it look like when you apply for funding? So let's kind of start at the start and dive in here. First up, we always solicit letters of intent before we solicit full applications. So you will submit a 3-page kind of overview summary with the basic outline of what you're proposing. PCORI staff then screen those letters of intent based on the importance, the relevance of the topic, responsiveness, and you will either be invited to submit a full application or not. Whether or not you're invited to submit a full application, you will get pretty detailed feedback on your letter of intent, and we always encourage a conversation with the program officer after that, just to help you kind of strengthen a future submission or resubmission depending on the outcome. So then fast forwarding here, you got your invite, you submitted your full application, we review it for compliance, and then meanwhile, in the background, our merit review officers are inviting external reviewers to serve on review panels. One big difference between PCORI and other funders is that our merit review panels include stakeholders and patients. So in addition to scientific people with content and methodological expertise, patients will be involved. They go through online review. Typically then, we have our in-person review panel meeting where maybe the top half of applications are discussed live. And then going back to the wheel, after that merit review meeting has occurred, things move pretty quickly. We work to develop our funding slates that we put forward for approval. We think about how well what happened during merit review, how well the application fits with its intended program area, whether there's, for instance, a methodological flaw that might really severely impact feasibility, and whether it's something that's addressable prior to award. Sometimes we have a really strong interest in a project, but we need to clarify some things. And so at this point, you might get some communication from PCORI staff. We call it our PCORI information request. Some of the things we might ask you about at this stage are things like, whether your budget's reasonable, your ability to meet recruitment goals according to the proposed timeline, and then kind of, stakeholder engagement and making sure that you're on track for that. Then we put together a list of our recommended projects for each funding announcement. It goes to a separate selection committee, which is comprised of a subset of our members of the Board of Governors. They review all of our slates of proposed awards. And then all of those slates go to our executive director for final review and approval. Right after that, you will be notified of whether your proposed projects are approved, and we post them on the website there. We issue contracts instead of grants. So contracts are more specific than grants. We have, why contracts and not grants? Our contracts are milestone and deliverable driven. So our payment to your institution is tied to expenses related to successful performance and achievement of the pre-negotiated milestones that you help us come up with. So in other words, contracts are more specific than grants, and they have deliverables that we have to establish in advance. And we're significantly involved throughout the course of the project. So you might be meeting with us, monthly or bi-monthly, depending on the phase of the project, to give updates and get input. And so we work as a team with you. How many PIs can your application have? Our policy is that you can have no more than 2 PIs, dual PIs on an application. One will be the contact PI, who's ultimately responsible for submitting and communicating with us, but our max is 2. I'm moving very quickly, so again, I will share these slides. If you are funded, your project will be managed by a team of PCORI staff. So this will be at least 1 program officer, a program associate, a contract administrator, and potentially also an engagement officer on certain funding announcements. We work very closely to build a partnership with you and help you monitor progress and troubleshoot any challenges that arise in your work. And we also keep a pretty close eye on your milestone completion. And then at the end of the project, we receive a final research report from the team that we review. And then there's also a draft final research report. This is part of our statutory mandate that all of our results have to be externally peer reviewed, and that the results have to be made available to the public pretty rapidly. So if you look on our website, you can find some of those completed reports. I'm going to pivot a bit here to talk about kind of some of our priority areas of focus. These are not specific funding announcements, but are themes that kind of drive the development of our funding announcements, which I will share in a moment. Over the past year, I would say, our strategic planning process was informed by, like I said, stakeholders whose needs and desires were considered when we thought about what to prioritize. All of our stakeholder input, as well as landscape assessment, evidence synthesis, and research agendas developed by our engagement award program were considered and kind of distilled into a set of topic themes, which are here. We have 12 topic themes of interest. These will inform funding opportunities over the next several years. There are 8 listed on the 3 kind of boxes on the slide. These were approved last summer to speak to broad health issues that face a considerable portion of the US population. Some are focused on populations, some health behavior, and some are condition specific. 8 themes that you see reflected on this slide joined 4 existing themes that were congressionally mandated. So that's preventing maternal morbidity and mortality, improving outcomes for people with intellectual and developmental disabilities, addressing COVID-19, and rare disease. So you will see both these 8 plus the 4 I just mentioned, and our national priorities for health reflected in our funding opportunities, current and moving forward. I wanted to also include one and a half slides on PCORNet, which is our national patient-centered clinical research network. This is a national resource funded by PCORI where high-quality health data, patient partnership, and research expertise deliver fast answers to ultimately advance health outcomes. So this is the kind of research ecosystem, if you will, that has long been pursued, kind of this fully integrated network where data, research expertise, and patient insights are built in and accessible from the start. PCORNet already has a strong infrastructure. It's well suited to help support and conduct real-world evidence studies, pragmatic clinical trials, population research, and studies on how best to engage patients themselves in research. PCORNet has over 40 participating healthcare systems, 70 sites from all across the country, and more than 30 million patients that are available for clinical trial recruitment. So we really wanted to design this in a way that reflected the demographics of the US population broadly. It's open to all, so we encourage investigators, funders, patient groups, and health systems to explore PCORNet and consider it as a platform. And actually, one of our broad standing funding announcements has a category specifically designed to support investigators who are interested in leveraging PCORNet. So speaking of that, I wanted to give a snapshot of our typical suite of funding opportunities that we offer throughout the year. This slide kind of represents what you might see in one cycle. Our funding announcements can be either broad calls for research, so things like, our broad pragmatic studies, our methods, our science of engagement. Sometimes our funding announcements are specific. So things like a topical might be focused on something like sleep health, for instance. I want to call your attention to the blue box on, I'm on the wrong slide. There we go. I want to call your attention to the blue box on the right side of the slide, which includes our 2024 funding cycle letter of intent deadlines. But you can always see our current and upcoming funding and past funding announcements on our website to review detailed individual announcements. So I will go through each of these opportunities and try to cover kind of the broad important points. But again, the full PFAs are always listed on our website. So our broad pragmatic studies are issued 3 times a year. This is designed to fund investigator-initiated high quality work. We have 3 categories, which just reflect different maximum budgets. But the third, category 3, is the one that I mentioned previously, designed to support work in using PCORNet. The maximum research project performance is 5 years. For category 1, the maximum direct cost is $5 million, and for category 2, it's $10 million. For all of our broad pragmatic study applications, you'll be asked to designate a national priority, one of the 5 that are listed again here. And you might align your application with one of the 12 thematic areas that I referenced early, and or a special area of emphasis. Oftentimes when we put out a call for our broad pragmatic studies, there will be 3 or 4 areas of emphasis that we're particularly interested in, that we invite investigators to respond to. We have a methods PFA. This is one that funds projects addressing methods gaps and helps us lead to stronger evidence generated by CER. This is a smaller budget, shorter period of performance, but again, it's designed to support methodological advances that address gaps or help us generate better evidence. We also have a science of engagement funding announcement. Again, these are standard kind of reissued multiple times per year that seek to build an evidence base in engagement work. So how to capture structure, process, and outcomes, techniques, how to best engage patients and stakeholders in research, and how to adapt techniques, perhaps. So right now we're interested specifically in developing and validating new engagement measures and or testing, developing and validating engagement techniques. 2 to 3 years, maximum direct costs 1 to 1.5, depending on which area you're focusing on here. So we also have topical funding awards. I am particularly excited about this slide because, as I mentioned, I'm the lead for the sleep health topic development work group. And so these will be designed to solicit applications centered on one of our 12 priority areas. The first ever topical PFAs were released this past fall, and the 2 that went first were sleep and cardiovascular health. Sleep will be reissued in cycle 1 of 2024. The pre-announcement is already on our website. And then maternal morbidity and mortality and IDD will also be topicals in cycle 1 of 24. So these are broader, more narrow than our broad calls for PFAs. And sometimes our topicals also include special areas of emphasis. So for instance, within sleep health, we had a special area of emphasis. We were very interested in applications that were focused on advancing sleep health equity. And then we were also interested in, for the next cycle, we've added one that's focused on sleep in inpatient settings and how to improve sleep health in that space. And then our largest award, PLACER, which stands for Phase Large Awards for Comparative Effectiveness Research. These are a 2-phase awards where there's an initial feasibility phase where the maximum total direct cost is $2 million. This is 18 months. And then a full-scale trial where in between the feasibility and advancing to the full scale, there's an assessment period where we decide about the project moving forward. The second phase is up to 20 million in direct costs. These are typically quite complex, quite large studies. They require a data coordinating center and a dual PI structure. And these have to be randomized. We don't accept any observational applications here. What else did I want to say about PLACER? That's it. So I wanted to, we're almost done and we will get to questions. I wanted to provide a short primer for people who are interested in submitting a letter of intent, maybe now, maybe a year from now. I wanted to go over kind of what our letter of intent review and merit review process looks like in a little bit more detail to give you a sense of what's happening behind the scenes. So I mentioned some of this before, but I want to kind of lay it all out in one place. So when you submit a letter of intent, again, at least 2 PCORI staffers review each, and then we have a committee that decides which ones are invited to submit a full application. If you're invited to submit a full application, our external merit reviewers review them independently and submit written critiques and scores, much like what happens at NIH. Following that preliminary review, a subset moved forward for discussion during our in-person merit review meetings. And then finally, like I said, goes to selection committee, and ultimately our executive director, Nikayla Cook, considers and approves the slate recommendations. So you want to submit a letter of intent. What goes into the 3 pages? Because it's very limited real estate, and this is your opportunity to kind of, make the case that this is a compelling question, that your comparators have efficacy and or are in widespread use, that you've thoughtfully considered how you will engage patients and stakeholders throughout the purpose of the study. You'll talk about the feasibility and also kind of how it aligns with PCORI's national priorities and topic themes of interest. It's a lot for 3 pages. So if you do have an idea, we have lots of ways for you to talk to us, even at the idea stage, to talk to a program officer to help you flesh out how to write a strong letter of intent. And then after that phase, how to write a strong application. I think I'm going to move fairly quickly through these next few slides. I don't want to spend a whole ton of time on kind of example studies, but I did want to highlight a few that I think really capture the equity focus that I know many of you are very interested in. And I also understand that there are quite a few people working on diabetes. So I thought this project was maybe might be meaningful. This is a study focused on 3 approaches for improving self-care activities for African-American adults with diabetes and other chronic health concerns living in low-income areas. So the approaches that they were comparing included a diabetes education guide, that guide plus text messages, and then the guide plus in-person health coaching. And so what they found is that people who received the text messages, in addition to the guide, reported more days of healthy eating following their healthy eating plan. They didn't differ in the number of days of exercise. So again, just an example of a sample research question that was answered through one of our CER funding mechanisms. And we really think that, doctors, clinicians can use these results when thinking about how to best support patients with chronic disease self-management. Another one I wanted to highlight, this is a asthma study comparing treatment approaches in African American, Hispanic, and Latino adults, the PREPARE study. This one got quite a bit of press recently. It was in the New England Journal, cited and up to date. And this was a study comparing asthma treatments in minoritized populations who are disproportionately burdened by asthma morbidity and mortality, but had historically been underrepresented in asthma management studies. So the main finding here was that in addition to usual care, the provision of a inhaled corticosteroid when patients use an asthma reliever or nebulizer and a one-time instruction on how to use it resulted in lower risk of severe asthma exacerbations, better asthma control, better quality of life, and reduced days from work or lost days from work or school, which were all very, very important outcomes to patients and to clinicians and their family members. Based on the results of this project, we actually also funded an implementation project that aimed to apply the inhaled corticosteroids intervention in 4 different diverse medical systems and to evaluate adoption and feasibility and acceptability. For the sake of time, I'm going to skip the next one. And did not have time to create a slide on it, but I understand that there is someone on this call who has a press release forthcoming, or results that are currently embargoed but won't be in a few days, who had some exciting findings. So I'm curious to hopefully learn more about that one during Q&A. I have the snapshot, but if I touch my screen, it's going to make my slides go away. So I want to circle back to that. And I'm very curious to hear about your experiences kind of working through the, if you can remember what it was like to kind of initially apply and what it was like to work with the PCORI team throughout the duration of the award. These additional resource slides all have handy QR codes, so I am going to breeze through them quickly. And if you are interested in any one of these particular resources, highly encourage you to just scan. Technology is wonderful. We have a research fundamentals course that, oftentimes, I'll be honest, for researchers, this is not new information, but if you're pulling in stakeholders who might be new to research, this course can be very, very helpful. This is something that helps them understand, what is patient-centered outcomes research? How does research work? And how can I best partner with the research team members? So again, scan the code if you're interested. We also have an engagement tool and resource repository. This is more than 400 engagement-related tools and resources that have either been developed or are currently in use by PCORI awardees. It's a searchable kind of peer-to-peer repository. Lots of great information there, case studies, toolkits, training manuals, etc. This is the one I want to spend some time on. So tips for building effective multi-stakeholder research teams. You have an idea for a project, but presumably you're going to need to pull in lots of people from across lots of different disciplines. Maybe it's clinicians, maybe it's researchers, maybe it's community members, patients. I mean, that is our expectation. So we have a resource on how to build strong teams. We also, so how to initially engage stakeholders, and then once you get them, how to work with them. Lots of evidence-based information to help you as a researcher and help your teams kind of function more efficiently. We also have evidence updates. So oftentimes we'll collaborate with stakeholder organizations to either disseminate research findings or help people understand the evidence base, essentially. So this reflects kind of one outcome of these efforts. We have patient and clinician versions of our findings from systematic reviews and PCORI funded studies. We talked about PCORNet, but here is a way to kind of get more information, more specific information on PCORNet. Again, it's open to everyone. And we do have a specific category in one of our broad standing investigator initiated funding announcements. So courage there. Probably the most important one is if you want to keep in touch with us, if you want to get notifications about funding opportunities, if you want to get notifications about results or upcoming webinars, meetings, events, strategic initiatives, we actually send weekly emails about these things. So you can sign up to receive our weekly email to stay in contact. Also even if you're not interested in applying for PCORI funding, there are lots of ways to get involved. We have 5 advisory panels. So clinical effectiveness and decision science, healthcare delivery and disparities, rare disease, clinical trials, patient engagement. We solicit input from a wide range of stakeholders who meet regularly to help us stay on track. We have an ambassador program. You can serve as a merit reviewer, and we have lots of exciting events, including but not limited to our annual meeting, which just happened about a month ago, but will happen again next year. I've thrown a lot of information at you in the last 45 minutes, but our door is always open. If you have a question about a potential project, no matter what phase of development your idea is in, you can always reach out and meet with a program officer. We can also help you think through, what what funding announcement might make the most sense for my idea. You can also look at our submission instructions. We have a wealth of other resources, including FAQs and engagement tips and tricks. All of the things are on our website. And then lastly, I think I just have our social media and or how to subscribe to our newsletter. So I will, I think, stop sharing the screen so that we can hopefully move into Q&A. I see some chat things.
There has been a little bit of chat in the background. Yes.
Okay. So I can start there unless, Jill, what would be your, how should we do this?
Well, first, I just want to say thank you because you have been extremely generous with your time and in prepping for this and planning for it. So thank you from all of us. I'll also say that you have tremendous colleagues. You've been so wonderful as many of our investigators have gone after research funding with you or putting proposals in. You're so generous with your time in general with meeting PIs and chatting with people. So I think for anybody that has not pursued PCORI, I think it's good for everybody to know how accessible you are. So I don't know, before we go into, I guess this is probably a very quick question. The first one that came up, we have a very strong group of people here at the university across many of the health science schools focused on healthy aging. And I know that you just had an announcement and that was back in September, but we're wondering if your sleep study or your sleep cycle was going to be coming up again, would we see the aging opportunity come up again?
I was muted. Aging will not come up in cycle 1 of 2024. That does not mean that it will never come up as a topical PCORI funding announcement. However, healthy aging is one of our priority focus areas. Therefore, do not wait for a specific topical PCORI funding announcement to come out on healthy aging. Submit your healthy aging related applications or letters of intent under our broad, our standing funding announcements. So even if there's not a topical, there might be a special area of emphasis that's called out in, like, for instance, our broad pragmatic studies, in our placer, the 2-phase award, that larger awards that I mentioned. And even if there isn't a specific call out, again, most of the work of the applications we get are purely, investigator initiated broad. They're not necessarily aligned with one of our topicals. So so you'll see it as a pre-announcement if and when we do another topical, but again, you don't necessarily need to wait for that in order to submit your aging related ideas.
Great, thank you. You had mentioned, and you and I were corresponding today about the exciting
Yes.
data that Dr. Talal is about to share. So we actually have 2 of your funded investigators in this meeting.
Excellent.
So Dr. Talal has been supported by your agency, and so has Dr. Chang, who is in our School of Nursing. So thank you from both of them. But Dr. Talal, did you want to say a couple of words about?
Sure. So thank you very much. And I'll just say, you asked if I would cover. PCORI has been wonderful to work with. Originally applied in 2014 as a small project, said develop a statewide network, come back in. I did, was funded in 2016. We conducted a study comparing telemedicine with usual care at methadone programs, 12 methadone programs throughout New York State. Completed enrollment a couple of weeks before the pandemic lockdown. And I'll just say that PCORI was very responsive, extended the contract after COVID related delays, gave us additional funding for looking at social determinants of health. And we had a 2-year follow-up to look for reinfection, I'll be presenting those data at the liver meeting on Monday. So thank you very much for your ongoing support.
Congratulations. Sounds like a wonderful, I'll keep an eye out for those results.
As long as, and not to put you on the spot, Dr. Chang, did you want to say anything as well, since you've got experience?
Yeah, sure. Thank you for the opportunity. And I echo what Dr. Kala just mentioned about the wonderful experience in terms of working with PCORI. And I actually have 4 project program officers throughout.
Oh, wow.
Yeah, I have 4, and each one of them was just so wonderful. And the transition was so smooth. So I really appreciate it. We have about a year and a half from completion, but we are almost in the the process of finalizing the recruitment. And our preliminary findings showed significant improvement mental health outcomes for people who received either a Zoom delivered mindfulness stress reduction intervention or app delivered MBSR compared to control group. So the findings are very promising. So thank you so much for the support.
That's excellent. Great. Thank you. Thanks for your hard work. And I think, you highlight a good point, is that oftentimes our work is focused on not necessarily different, maybe not necessarily 2 completely different interventions or approaches, but mode of delivery, what makes the most sense, especially with COVID and the rise of telehealth and app-based intervention and telemedicine. So it's another common research question or type of research question that we see.
So Alyssa, can I ask an administrator question?
Sure.
Years ago, I was poking around and I think I found a chart that wasn't done by your team internally, but it was somebody else's analysis on another school's website. But can you just, if you know, or if you're comfortable sharing, success rates, like from LOI to proposal to funding? I haven't been able to find the data anywhere, and it's just always a curiosity.
Yes, that's a really great question. I need to look. I know that it was just updated internally, but I don't know if we share those publicly. I will follow up with you, I promise. When I have an answer, I will write it down. And yeah, let me remind myself.
That's okay. I'll email you. Don't worry. Does anybody else have any questions?
To that, just to add one addendum, one big difference I think between PCORI and other funders is that we don't have a limit on the number of times the same idea is resubmitted as an idea. So even if, for instance, you submit an LOI, you are invited to submit an application and that application isn't funded, and but you got merit review feedback, you have your discussion notes from the in-person merit review panel, you are welcome and encouraged to resubmit the idea incorporating feedback. And again, you can submit that infinitely. Not that that's always appropriate or desirable. However, I think it does help, especially when people are have new ideas and are going through the process for the first time, kind of think through how to strengthen the next submission.
Great. Thank you. I don't see any other questions in the chat. Let me just double check to make sure that I'm not missing anything.
Could I ask a question? Oh, go ahead. I'm sorry.
I wanted to ask, a couple of years ago, maybe 2 or 3 years ago, there was a movement to incorporate the whole spectrum of outcomes. And I didn't know, had that been adopted? I mean, it was very useful and we did a lot of qualitative work in our study, which we had not originally proposed. But has that moved forward now, or has that, what's the status of that initiative?
So yes and no. We recently actually did a limited competition supplemental funding call for applications to, again, supplement existing awards to support their inclusion of patient-centered economic outcomes. That was again a limited competition, kind of one time. Not to say that things like that won't continue to be offered or potentially even included as part of our initial funding and not like a separate, a separate supplement or enhancement. So yeah, I think we're in a lot of cases kind of piloting different types and how to best kind of support those while still obviously complying with our mandate. So more to come.
Thank you.
Space.
We have an instructor in the School of Public Health. Dean, do you want to jump on, or you want me to just read the question for you?
Oh, have you worked with me?
Hello, can you hear me?
Yes.
Yes.
Hey, thanks. Great presentation. I wanted to ask, has your organization ever worked with Indigenous populations? And
We have.
if you could just let us know like what kind of work you've done.
Yeah, I would need to do a little bit of digging in terms of, I mean, everything that we've, all completed research, ongoing and completed research projects are available on our website and fully searchable. So I would need to kind of start there. So speaking from kind of the work that I'm personally involved in addition to sleep, I also support the substance use topic theme work group. And we've done quite a bit of stakeholder engagement with tribal communities on alcohol use specifically. That I believe will be, potentially slated as a future topical, whether it's, again, the format kind of varies. So whether it's its own topical funding announcement that's only focused on that one thing, or whether it's a special area of emphasis that's called out. But yes, we certainly do. I think in general, any kind of historically underserved or excluded populations often become our high need, our priority areas of focus. So you'll opt, like even for sleep, the sleep health, you'll see specific groups called out that we're particularly interested in. So the answer is yes. The extent of it, I would need to do a little bit more digging.
Thank you.